The purpose of this film is to spark conversations and establish touch points to guide discussions about the COVID-19 pandemic in a way that is grounded in clinician and healthcare workers' experiences. This film was created using footage from interviews of people who agreed to share their stories of working in La Clínica de Familia during the COVID-19 pandemic. The clips you will see were selected because they represent common patterns. Participant voices and personal experiences differ, but they shared a belief that telling their clinic story would matter. In some instances, people were willing to share, but were not comfortable being on video. Not everything you hear will be directly relevant to situations at present, but each story can spark ideas and conversations that allow for insightful discussion of the pandemic. Catalyst films are part of the broader, wide engagement for assessing COVID-19 vaccine equity, or WEAVE project. More information about the WEAVE project can be found at www.weavenm.org.
I work for an FQHC. We see patients from all different walks of life, those with great insurance, not so great insurance, and those without insurance. Our organization was originally just basically a ragtag group in the early mid-70s whose idea was to disseminate health information to field workers. And I think that foundation actually helped foster that trust between our providers and our COVID team and the borderland population.
And so it was just very challenging at the beginning. But what I found so rewarding is that in spite of all those challenges that we were all facing and the stressors that came along with it, that everybody was so resilient, not just like our staff, but also our patients, right? They were amazing because we've changed the whole way that we provided healthcare. I mean, it changed from one day to the next. We had to come up with innovative ways to deliver our healthcare to these patients, right?
Some places may be shut down temporarily. That was not an option for us, and it was not something that we would have even considered, that our doors were open to anybody and everybody. We actually, I think, saw an increase in referrals during COVID. People were seeking mental health services, and a lot of places were just not offering at that time, and we were. So I saw that a lot of people were very grateful for that and thankful to have the flexibility to still have their therapy.
We have dental, we have behavioral health specialties, we have early Head Start, and everybody was just kind of in their own little world, right? Like doing their own thing. But because we all had to come together, it impacted the whole organization, right? Everything you do, it's a domino effect. And so that's something that I think has really strengthened us as an organization.
It was a very stressful time for everybody, not just me as a member in the community, but also as an HIT manager. I remember being on vacation in December that year that the vaccines rolled out. I had to stop what I was doing and actually get in and build the vaccines, make sure we had the CVX codes for the immunization so that our providers could quickly get out there and start vaccinating. And the reason is there's been a lot of death around us, and getting those vaccines quickly to me was so important. So I did. I couldn't ignore the emails. I couldn't say, well, I'm out of the office right now. I'll do them as soon as I get back.
All of us were isolated, and it's hard to, see family or, friends, and then also, having relatives or family members pass away. So I think that's one of the biggest things that has affected me as, also as a person, but also in my practice.
And we would render care behind a mask, behind a face shield and a gown to patients at their door side, at literally the side of their car. We had to examine patients. We had to keep things going. And it was, if anything, a testament to our providers in our organization that they were so readily able to adapt. I'm very proud of my clinic, but there was no doubt a lot of fear. We just didn't know.
And I just remember in the middle of summer, right, it's like 100 degrees outside, and you're wearing full PPE. So it's like wearing a trash bag over your clothes, over a mask, over a face shield. So you can imagine, just it was just, horrible conditions. And we started off with a very small operation that built up, to testing hundreds a day. And eventually, we made it into a really well-oiled machine of testing and then eventually vaccinating. We vaccinated, you can say like thousands of Southern New Mexico residents, as well as testing thousands of Southern New Mexico residents.